Accountability Act. And this is federal law that was enacted in 1996. Before HIPAA, there were no general accepted set of security standards or general requirements for protecting health information that existed in the healthcare industry. Although we may think of HIPAA as being all about patient privacy and the protection of health information, HIPAA was created to simplify health insurance for people changing jobs and to encourage the healthcare industry to use digital medical records. Basically, HIPAA was landmark law designed to increase the portability and accessibility of health insurance. It introduced provisions that protected individuals from losing their job or their insurance. When they switched jobs, they were moved to a new state, and it prohibited insurers from denying coverage based on pre-existing conditions. So the four primary objectives of HIPAA. We'll start with assure health insurance portability by the elimination of job lock due to pre-existing medical conditions. So job lock happened when people with pre-existing health conditions were afraid to leave one job with insurance for another job with insurance because the new job insurance would not cover their condition or would impose long waiting periods. Reduce healthcare fraud and abuse. Prior to HIPAA, medical fraud and abuse was significant. Enforce standards for health information. Before HIPAA, enforcement of existing laws were often inconsistent and ineffective. And last but not least, guarantee security and privacy for health information. Health information privacy was like the Wild West. There was no federal rule governing the privacy of health information. So basically, these objectives together are aimed to improve the efficiency and the effectiveness of the healthcare system while protecting patient privacy and security. Who must follow HIPAA? HIPAA applies to a wide range of organizations, and they're just not healthcare providers. Here's a breakdown of who must follow HIPAA. These are referred to as covered entities: health plans, healthcare clearinghouses, healthcare providers, including doctors, clinics, hospitals, nursing homes, and pharmacies. And HIPAA also applies to business associates. So put simply, this means it applies to anyone who has access to, needs to use, or needs to disclose private health information. And going back to a business associate is a person or organization that handles protected health information for a covered entity or provides services to them. To put simply, they're organizations that handle sensitive patient data on behalf of the covered entity. Some examples of potential business associates are data processing firms, software companies that may be exposed to PHI, medical equipment service companies that handle equipment that stores PHI, consultants hired to conduct audits, lawyers answering services, and medical transcriptions services. And as a covered entity, it's really important that you have them sign a business associate agreement. This is the business associate agreement that you would have them sign. And it's always good to have them sign your agreement, not theirs. So what's the BAA do? It formalizes the relationship and ensures compliance with HIPAA's privacy and security requirements, while clearly defining how PHI can be used, disclosed, and protected. And this is a requirement through HIPAA. So one of the rulings is the HIPAA security rule. This rule was enacted in 2005. This rule is essential for protecting the privacy and security of electronic health information. It requires covered entities, practices, and business associates to implement a variety of administrative, physical, and technical safeguards to prevent unauthorized access, use, disclosure, alteration, or destruction of electronic PHI. Compliance with the security rule is crucial for maintaining patient trust, avoiding costly penalties, and protecting the reputation of healthcare organizations. So an example of an administrative safeguard would be employee training, having written policies in place. A physical safeguard would be like having signs labeling restricted areas as well as locked doors. Technical safeguard would be having security protocols set up, such as encryption, antivirus software, and firewalls in place. Another requirement through the HIPAA security rule mandates that every practice, no matter what the size, it could be a one-person practice to thousands person practice, must designate a privacy officer. And the privacy officer can be any staff member, and they would be responsible for developing policies and ensuring staff training, keeping track of your business associate agreements and your notice of privacy practices, as well as handling patients' complaints. And I can't stress enough that handling your patients' complaints really need to be prioritized. The last thing you need is the patient calling HHS regarding any issues. The role of a privacy officer is crucial for preventing internal violations, safeguarding patient data, and maintaining transparency and accountability in handling protected health information. The privacy rule was signed into law in 2003. This rule specifically outlines how protected health information can be used and disclosed. The privacy rule is essential for protecting the privacy and security of sensitive health information. It helps to ensure that individuals can trust that their health information will be protected and used only for appropriate purposes. And part of the privacy rule is the minimum necessary rule. You should use or disclose the least amount of protected health information needed to get the job done. Covered entities are permitted to use and disclose PHI for. Okay, so the HIPAA privacy rule allows covered entities to disclose protected health information about an individual without requiring the individual's authorization for, number one, treatment. And this would be providing, coordinating, or managing healthcare. Number two, payment, obtaining reimbursement for healthcare services. Three, healthcare operations, administrating, planning, and evaluating healthcare operations. Public health activities, such as reporting births, deaths, injuries, or communicable diseases. And of course, emergency situations, disclosing protected health information to prevent a serious threat to the health or safety of an individual. HIPAA incidental use and disclosure refers to the unintentional sharing of protected health information during healthcare services. These would be accidental and unavoidable disclosures that can happen even when HIPAA requirements and safeguards are followed. Some examples would be a nurse might discuss a patient's condition with another healthcare employee in a shared workspace. Employees working in a healthcare facility share workstations or computer screens, and PHI belonging to one patient is inadvertently viewed by another employee. Okay, so a HIPAA risk assessment is a requirement from Health and Human Services, HHS. This should be done annually. This is a comprehensive document that outlines your practices, vulnerabilities, and threats to protected health information. Essentially, a HIPAA risk assessment is a roadmap to help you understand and manage the risk to PHI, ensuring your compliance with HIPAA regulations. So this would include identifying your assets. So on the risk assessment, you would list all systems, devices, and data that contain PHI. Identify threats evaluating potential risks from both internal and external sources, analyzing vulnerabilities, determining how threats could exploit weakness in your system, prioritizing risks, ranking threats based on their likelihood and potential impact, developing mitigation strategies that would be creating plans, addressing and reducing identified risks. Last but not least, documenting findings and recommendations. So that would be organizing results and proposing actions to improve your security posture. HIPAA risk assessment, is this required? Yes, the HIPAA risk assessment is required and is crucial for achieving strong compliance practices, mitigating risks, and safeguarding patient data. Covered entities need to conduct regular documented risk assessments as an integral part of their HIPAA compliance program. This document should contain a comprehensive evaluation of your organization's vulnerabilities and potential threats to protected health information. So some of the benefits of a risk assessment are prevent breaches, improve security, reduce liability, and maintaining HIPAA compliance. That's a gigantic one. Any suspected breach investigation, one of the first things they ask for is a copy of your risk assessment. So it is a requirement that you have that. Very important. This is an example of a risk assessment. They basically just questions, and you go down and yes or no. Is there a gatekeeper to control access to office during business hours? And you would just go down and answer these questions. Pretty straightforward. It's required every year. You could just update the risk assessment if nothing changes the next year, but it is a requirement. Patients' rights mandated by HIPAA. Under HIPAA, patients have a number of rights over their health information. They have a right to access. Patients can request and receive a copy of their medical records. Right to amend. Patients can request an amendment to their medical records. Right to restrictions. Patients can request restrictions on how their PHI is used and disclosed. Right to an accounting of disclosure of their protected health information made by their provider. Right to file a complaint with the Office of Civil Rights. Right to be informed of a breach. So the HITECH Act was enacted in 2009, and this improved HIPAA's privacy and security rules. It promotes electronic health records and increases penalties for non-compliance. The Act also holds business associates to the same security standards and healthcare providers and requires them to notify individuals in case of a breach of protected health information. So HITECH extended HIPAA to business associates. It increased penalties for violations, breach notification requirements, where it was mandated that covered entities and their business associates notify individuals, HHS, in some cases, the media following a breach of unsecured protected health information. It also promoted electronic health records and enhanced patients' rights, such as records and requests and changes to their medical records. So as you can see, this was a very significant addition to HIPAA. Just a little bit about HIPAA identifiers. These are specific pieces of information that can be used to identify a patient or an individual, such as someone's name, including aliases, addresses, street addresses, city, state, dates, phone numbers, Social Security numbers, health plan beneficiary numbers, account numbers, email addresses. Patient identifiers are likely targets for breaches and can cause serious harm if compromised. It is your job to protect these identifiers. Here are some steps that you could take. Implementing strong security implementing strong security measures for electronic and paper records. Limit access to PHI on a need-to-know basis. Train staff in HIPAA privacy and security policies. Regularly audit systems and processes to ensure compliance. You need to keep in mind that unauthorized disclosure of protected health information can lead to serious penalties, such as financial fines and criminal charges. So these identifiers are basically protected health information. Okay, so what is a HIPAA breach? It's basically any acquisition, access, use, or disclosure of protected health information which compromises the security or privacy of protected health information. Some of the things that may constitute a breach would be unauthorized access. When someone gains access to PHI without proper authorization, such as accessing PHI without the patient's consent or valid legal reason, or using PHI for personal gain. Next would be unauthorized use. Sharing PHI with individuals or entities not authorized to receive it. Using PHI for purposes beyond what is authorized. Unauthorized disclosure. So this would be unintentionally revealing a PHI, such as leaving a patient's chart open in a public area, sharing PHI with someone who is not authorized to access it, third parties gaining unauthorized access to PHI through cyber attacks or breaches, losing or having an unencrypted device stolen that contains PHI. So a breach could happen orally, written, or electronic. So an oral breach would be disclosing patient information during a verbal conversation. For example, in a waiting room, hallway, or over the phone without proper safeguards. This could happen if healthcare staff talking too loudly about a patient's condition. Written breaches, unauthorized access to or disclosure of patient information stored on paper. This could happen if medical records were left unsecured or falling into the wrong hands, or a written document containing PHI being improperly disposed of. And last but not least, electronic breaches. Impermissible use and disclosure of ePHI. How does this happen? Unauthorized access to patient's file on a laptop, tablet, or other device. Sharing PHI over unsecured networks, or posting patient information on social media, and that does happen. So here are some factors that are determining a breach. Was the information involved protected information as defined by HIPAA? Unauthorized access, use, or disclosure. Did someone gain access to PHI who wasn't authorized to do so, or was PHI shared inappropriately? Likelihood of harm. Is there a significant risk that the unauthorized access, use, or disclosure of protected health information could cause harm to the individual? And also nature and extent of the compromise. How much PHI was involved? And what was the potential for misuse of that information? The Office of Civil Rights also considers other factors such as intentional versus unintentional, and the organization's efforts to mitigate the breach. Was the organization doing something about it, or did they just let it go? By focusing in on these four factors, healthcare professionals and organizations can better understand the complexities of HIPAA breaches and take steps to protect patients' privacy. Okay, so the HIPAA breach notification is requires entities to notify affected individuals and the Department of Health and Human Services when PHI is breached. Okay, so if we look on the left side of the picture here, if under 500 people are infected, you need to notify affected people within 60 days of the breach. notify HHS within 60 days of the end of the year in which the breach was identified. The next category would be if over 500 people are infected, notify affected people within 60 days, notify HHS within 60 days, most likely notify a major print broadcast media outlet within 60 days as well. So here are some potential outcomes of a breach. Okay, so of course, civil penalties, fines ranging from 100 to over 50,000 per violation, and an annual maximum for identical violations of 1.5 million. Could also have criminal penalties in cases of knowing violations with intent to sell, transfer, or malicious harm. Penalties can include fines up to 250,000 and up to 10 years in prison. This is a big one, reputational damage. Patients often lose confidence in an organization's ability to protect sensitive data. It really is difficult to bounce back from a breach, as well as business interruptions can be caused by crippling systems downtime, extensive remediation, and legal obligations. So please, as a conclusion, keep in mind that safeguarding protected health information involves three key practices: protecting information from unauthorized access, whether physical or digital; disclosing the least amount of PHI to perform your job or to get the job done; reporting any potential privacy or security incidents immediately, no matter how small. Compliance is not just about avoiding fines, it's about honoring the trust your patients place in you every time they share their sensitive information. And thank you. Okay, Christy.
Thank you so much for that presentation, Dwayne. Really great information you shared with us. Is there anybody who had any questions for Dwayne? He can certainly answer. Lynn?
I'll jump in first unless someone else would rather go first, but thank you for a great presentation, Dwayne. I just, what's one of the most common gaps you see in practices, HIPAA privacy and compliance practices? And what would be a practical first step in addressing that most common gap that you see in practices when you're out doing your training?
A big one is actually training. Getting everyone on board with HIPAA is really important. So you got to keep in mind that this information, everybody should know about it at the practice. All it takes is one employee not to do the right thing for there to be a breach. So it's really, really important that everybody's on board with this information. I would say just having things in order, such as a risk assessment, being proactive, training logs, risk assessment. That's where things are important. And Sharon's going to get into the cyber part portion of things. So that's basically what I would say with that. Thank you.
Thank you.
You're welcome.
Thank you so much. Anybody has any questions, other questions for Dwayne? Okay. Well, thank you again for your great presentation, and we'll go ahead and we'll move on to Sharon.
Good morning, everybody. Thanks for allowing me to take time out of your busy morning to talk about cyber insurance. The topic of my presentation is why care about cybersecurity, and I'm going to piggyback off of what Dwayne just presented to you. You guys are holding a lot of information in your office. Used to be paper folders, paper files. Now it's all electronic. Because it's electronic, it's now easier for hackers, employees, whatever, to get into that information. So I'm going to talk about why you need to protect your practice, and ultimately having a good cybersecurity platform in the practice is also going to help with a lot of things that Dwayne talked about. keeping yourself HIPAA compliant, because I think the two marry together pretty well. Having good cybersecurity is also going to keep you HIPAA compliant, because you're going to make sure that patient protected information isn't going anywhere, that it's staying within the walls of the practice. So the next slide is basically just, some statistics. I mean, it's interesting to see what's going on in the world about how many people are accessing files, and how many sensitive files are opened and whatever. Statistics to me make good fluff. I mean, it's good to see what the numbers are, but I think in all actuality, what we need to talk about are what are the most common incidences that healthcare practices are seeing. Ransomware is about 29% of the claims that we're seeing. And then you've got people fraudulently transferring your funds, your banking information. That's taking up about 31% of the claims that we're seeing. And about 20% of the healthcare claims we're seeing are true data breaches. So the data, what is it really telling us? Out of all the business sectors in the country, healthcare has about 12% of the breaches that various companies are seeing, or all these companies that kind of track it. So we're right there next to professional services. I mean, we're kind of right at the top. You can go to the next slide, Christy, if you'd like. What you need to do is not only have a good system in place, but you need to know what your state or county laws are mandating that you do. If you're practicing in several states, you need to look at what each state requirements are. If you're doing telehealth in various states, you need to know what those states' laws are. I'm going to talk specifically about Delaware, and what we need to do is look at who's impacted, what the data is impacted, and the nature of these cyber attacks. Next slide, please. In Delaware, we have code 12B-100. And basically what this does is any company doing business in the state of Delaware, you must abide by this specific code if 500 or more Delaware residents who are your clients or patients have been impacted by a breach. What you as the business must do is you must notify each of the patients that have been impacted by the breach. If there are social security numbers that have been breached, you must provide minimally 1 year of credit monitoring services, whether it's a LifeLock or something like that. But the big thing here is if 500 or more Delawareans are impacted, you've got to follow the law here, or you're going to be impacted by fines, penalties, and fees from the state of Delaware. And if you look back at Dwayne's presentation, a good number of the HIPAA identifiers include social security numbers, the patient's health information, the patient's health insurer, whether it's Blue Cross, Aetna, whatever, their cell phone number, their email address, their phone number. You might even have credit card information in your office where you've accepted a payment plan from your patient, and as an accommodation, you're keeping their credit card information on file to just automatically draft or automatically hit their credit card for the monthly payment. Your credit card reading machines, they are also holding patient information, their credit card numbers and all of that. So if you do have a breach that impacts this information, you're going to have a HIPAA problem. And then you're also going to have problems with the state and ultimately the federal government, because once it hits 500 or more individuals, as Dwayne said earlier, you've got to let HHS know. So you're going to have several moving parts, and then add into this, if you've got other states, if you've got patients in other states that you've got information on and your system is breached, you now have to look at what the other states are mandating that you do. Next slide, please. Cyber attacks are continuing. These hackers are finding that your practice is a treasure trove of information, whether it's names, date of births, addresses, phone numbers, health insurance carrier information, social security numbers, all of that good stuff has a value to it. And each of those pieces can be sold to others for a price and ultimately leave your patients and you open to hacks or open to someone stealing identities and things like that. The average cost back in 2019 was about $4.2 million of what it costs a practice to recover or start moving through the cost of a breach. We have the highest average cyber attacks cost. This is about the 11th or 12th year in a row. When we talk about a cyber attack and the cost involved, it's not just the cost to you, the practice. There is an investigation depending on what was breached or stolen. I'm sure authorities are going to be involved to try and investigate who actually did it. Your notification costs, they're not cheap. When the state of Delaware tells you that you have to notify your patients and the government tells you you have to notify your patients, it comes at a cost. You have to pay for the development of that letter. You have to pay to print that letter. You have to pay to mail the letter. And in some states, they mandate that you mail the letter certified mail and track the receipt that that patient did receive the letter. Then you're going to have the expense of the LifeLock or the credit monitoring services. Delaware, if the Social Security number is breached, they're only mandating 1 year that you provide the LifeLock or credit monitoring services. Other states mandate up to 3 years. So you really have to look at what those costs are. And to give LifeLock to a patient for minimally a year, it's running you, the practice, about $80. So multiply that by the number of patients that you're having to provide this service to. All of that starts adding up. It doesn't include any other communications, whether you've got to hire a PR person to kind of help mitigate everything that's happening. And then if there's any regulatory fines, penalties, or fees, whether it's state or the feds coming at you with penalties, and then you've got litigation. There's nothing stopping any of your patients if, their data has been breached. And let's say, for example, it stopped them from being able to get the home of their dreams or whatever. They can sue you civilly. So you've got a lot of costs incurred once you get to the point where information was breached. Next slide. Again, here, this is more of the fluff, I think. It's just giving you some statistics. It seems like more and more healthcare providers are seeing breaches that are incurring more than 500 patients. So let's go to the next slide. Here, let's get to the nitty-gritty on what is causing these breaches. And when Dwayne was talking about the HIPAA checklist, I think you need to go a couple of more steps into that. Training is key, just like HIPAA training. Your cyber security training in your practice should be next. I mean, train that staff on what they can and can't do, what patient information should or shouldn't be passed along. Don't talk in the hallways, all of that good stuff. But then you need to tell your employees, these are the things that we're demanding in our practice, whether it's, okay, at lunchtime, if you're going to sit at your desk and use our computer systems to check your personal email, look on tmz.com, shop, whatever. We're not going to allow this anymore because you're letting those employees access these sites that you may or may not know is protected. Any open site is open to someone being able to get into your system. So you need to make sure that your employees understand what they can and cannot do in your office as far as what websites they should and shouldn't be going to. You also need to educate your employees on these phishing scams where they get an email from someone that it looks like it's important or has a recipient email that sounds or appears to be someone that they know, like an at christianacare.org or at the Medical Society of Delaware.org. All people have to do is just transpose some initials in the name. We all know that your staff is busy. We're all busy, and we don't take that couple of extra seconds to really look and see if that name is correct. They may be emailing people in your office saying, you know, Dr. X gave me permission to ask you for so-and-so's health record, or Dr. X gave me permission to ask for the W-2 information of all the employees in the practice, or the banking information. You've got to learn to protect yourself from these people who are very smart at trying to confuse yourself and your employees to give up information. One other piece that I find troubling is, and a lot of my clients aren't aware of this, is when I go into a physician's office, I take my cell phone, not to sit there in the office and play games while I'm waiting for you or whatever, but I go and I purposely go to my networks and I will have my phone scan for an open network. You'd be surprised at how many of my clients and prospective clients, their network is open. Some of you don't even know it. Others may not be aware and are completely oblivious to what has occurred, and it should be already secured, and maybe there was an issue. You need to make sure that your networks are secure, especially those networks that you're using to upload claim data to your billing company. Talk amongst yourselves by passing on the information internally. Make sure that network is secure. If you want to be nice and allow your patients or your guests to be able to play games on their phones while they're waiting and all that other stuff, have a guest account or have a guest network so that that can be used, but it's completely separate from the business side. All the stuff that's being protected is really secure. Another thing you need to also look out for is a lot of people are working from home. That's where I am. They're all using their own personal routers. Are you making sure that their router is secure? When they're transacting or doing business for your practice, is their network secure? Or is it even their network? I mean, is it their router that they're paying for on a monthly basis? I had a practice a couple of years ago who just casually mentioned that their biller is, you know, doing billing and all from home. And she happened to walk by and the office manager asked, because I brought up to them, I said, well, do you know if her router's secure? And, unfortunately, this young lady, she was very open and honest and said, she lives in a condo building and she was accessing the internet through one of the neighbors' open routers. That's not really something you want to do. So if you do have employees working from home, have them sign off that they're using a secure router to protect yourselves. Also, make sure your doctors, when they're going into the hospitals, their phones automatically jump to an open connection. So if you're going into Bay Health or Christiana or BB or whatever, it's going to jump to an open network. If they're on the phone or they're passing text messages or other information to the practice from their phone, make sure that they're using that secure section that the hospital provides to physicians and their employees or whatever, getting the information to you. And also watch your physicians using text messages. Please be aware that they should be done through secure means as well. So other common causes of breaches, negligence, again, that all plays back to, routers, people just not thinking about what's there. Your rogue employees, this is something nobody can predict, but you can have an employee that's not happy with how things are going at the practice. They bring in a thumb drive, nobody knows. They stick it in your computer and they're downloading files. Trust me, it's happened. It's not pretty. So you got to watch that. Maybe put in your employee manual that they're not allowed to do this. They can't bring in thumb drives. If they're good at this, they're going to do it, and it might be very difficult for you to even know that they're doing it. But protect yourself. Put that stuff in there. The social engineering, I touched on that a little bit ago about these phishing emails that are coming. Train your employees. Don't fall for something. If they're not sure that this email coming in isn't the right person, or they're second guessing themselves, tell them they've got to ask somebody, whether it's the office manager, the doctor, supervisor, something. And then watch your business associates. Who are you allowing in to the office to do things? Back when there were paper files, you could have a printer in there, a plumber in there, a painter, whatever, guys cleaning the carpets, even the people who come in and clean at night. Those kind of people can access your information, whether it was paper files that are there, and you may not have paper medical records in your office anymore, but I bet you have paper files on your employees. And what information is there for your employees? Name, address, social security number, all of that good stuff that people will want and can sell. So you really have to watch who's coming into the office as well. Next slide. This is another bit of, just some data. Healthcare breaches of 500 or more records. I haven't been able to update it since 2022, but you can see in the graph how it is growing. So next slide. How do we prevent them? I wish I knew. If I could prevent them, we wouldn't be here with cyber insurance and all of this other stuff. If we didn't have breaches, there wouldn't be myself talking about this. So what you've got to do is look at your vulnerabilities, see where some things are lacking, whether it's training, whether it's that open router, all things like that. Just take 10, 15 minutes. What you could do is assign an employee every Monday when they come into the office. Open your phone, check the networks. Let's make sure our network is still secure. If it's not, then you need to call your IT provider or, find out why. It could have been just a glitch over the weekend. It could have been, maybe there was a power outage and for some reason when the router, recycled back on, the network security didn't come along with it. There's a lot of things that could be preventing that. And if you're not checking it, you're never going to know. So here's the next slide is how you can take action. That HIPAA privacy officer that Dwayne mentioned, that might be a good person to champion or put in charge of making sure that your cybersecurity is working and that the training is taking place and all of these other good things. So, if you have an IT company that you're using, some of these things they may already be doing, but to me, do you know that they're doing them? I mean, maybe every quarter or every, certain number of days or months, you just check in with them and say, hey, is our security software up to date? Have all of our computers been updated with the latest Windows updates or whatever? Even your EMR provider, is everything updated? Make sure you have good password policies. You know, I know a lot of small practices, if, one person is out for a day or a week or whatever, everybody in the office seems to know her password so that she can get on because her computer has the access to all the health insurance companies so they can do the pre-auth and all this other good stuff. That's really not a good thing. Every employee should have their own password to access their own terminal if they are, or even when they're logging in and out. This also helps you if you need to find out who that rogue employee is. If you've got them logging in and out and they're using various computers in the practice, you can see who it was. You can see that it was ex-employee who had signed on to that workstation that particular day. And, by monitoring things, you could see that it was that employee who made the errors or that employee who downloaded the files. Make sure that you do educate the employees. If you do have cyber insurance, you're going to find that these cyber insurance carriers are going to provide you with cyber training. They're all little videos that you can use. Haul everybody in there for lunch and buy a couple pizzas and put that up on the your screen and let everybody sit through it. Next slide, please. Set expectations of the employees. Let them know that this is not something that the practice is going to tolerate. Put some policies and procedures together. Again, you can get just a framework of what policies and procedures you want to implement in the practice. You can make it part of your employee benefits, or you can make it as an addendum or through the training. What are you going to tolerate? What are you asking those employees to do or not do? There's some policy templates through hhs.gov that you can use that I found pretty easy to use as a template, and you can add certain things to it. Next slide, please. Here's just an overview of how you can use some of the training, or who in the practice should be using. You know, maybe put a cybersecurity team together. Maybe you've got, one employee in the office that is really good at computers, and really likes this kind of stuff. Maybe see if they'd be interested in doing some things. There's all kinds of ways that you can engage people in the practice, to learn more, to be more educated, to take some pride in making sure that this information isn't breached, and then make sure you're training the doctors as well. Next, if you've got a breach, more power to you. It's probably adding another thing to your plate as the office manager. You've got to make sure that you've got a good attorney on hand that's experienced in these breaches. Make sure you're following all state and federal guidelines. You might want to get an IT forensic team involved if you don't already outsource your IT services. If you're doing everything in-house, look for IT specialists that are experienced in trying to find out what the breach was, how it happened, and how to prevent it. Then you've got to start figuring out who's been impacted, notifying your customers. Next, you got to watch for hackers. They're the ones that are, basically coming at you from all angles. You're going to get internal hackers, you're going to get external hackers. You may wake up one morning, go into the office, turn on the systems, and there's that red flashing light saying we've taken over your EMR or EHR, and we're holding it for ransom. We're starting to see a lot of those. People are holding your medical records for millions of dollars. It used to be they targeted hospitals, large institutions. They basically hit all of them. I'm sure many of you have read in the newspaper, saw on the internet, several hospitals, large facilities, not only in the US, but around the world, were hacked and their information was held for ransom. Now they're going into physician offices. So you really got to watch something being your practice being hacked. And they're all getting through either a failed way through your router, an open access point, or through your employees going on to a website and it's not secure and they're kind of finagling their way into your system. Next slide, please. This one is just, again, some fluff on letting you know about hacking incidents. The next slide is telling us about a cyber attack on a New England health services provider, and 2 million patients of this healthcare facility were impacted in this. Next are some claims examples. I'm not going to read each one of them. If you want the slides, or you're going to go through and listen to the recording again, these are just some examples of different types of practices, what happened, and the approximate costs that were incurred. If you can jump through those, Christy, to the telemedicine titled slide. I'm just going to basically end this presentation on what I think is something that's ever growing, and what a lot of practices aren't aware of, and it's telemedicine. Your current malpractice carrier will cover telemedicine exposure as long as it's in the state that your physicians are licensed in. You have to make sure that you're aware of state guidelines for telemedicine. You also have to look at where your patients are sitting at the time of the telemedicine interaction. A lot of malpractice carriers, if the patient is sitting in Virginia for the telemedicine activity, that malpractice carrier is going to want you to have a Virginia medical license. And why? Because that patient can sue you in the state of Virginia, because that's where the error occurred, because the patient is sitting in Virginia. There's a medical error. They're going to sue you in Virginia. If your doctor doesn't have a license in Virginia, it doesn't help your malpractice carrier to defend you. So you really have to look at where your patients are at the time of the telemedicine activity. Granted, we know your patients are mobile and they go on vacation, they go on business trips, things like that. If you know the patient is on a business trip in Colorado and they're calling you because they need help with whatever health condition, noted in the file that the patient was in Colorado for a business trip. If the patient is in Florida for a family vacation, note that. But if there is a consistency that these telemedicine activities are occurring with that patient outside of a state where your provider, whether it's a physician or mid-level, is licensed in, you've got to let your malpractice carrier know and make sure that they're going to cover you in that state, and you better have a medical license for that state. I think that is basically it for me. Does anybody have any questions? Oh, the last is a takeaway. You get 50,000 minimally of cyber insurance from your malpractice carrier. It's bare bones, not a lot, but it's something. You can always look at cyber insurance as a standalone policy to help better protect you for all of these other items that are going to impact the practice if there is a breach. Does anybody have any questions?
Sharon, I'll ask a question if no one else wants to go before me. Well, first, I have a comment about the business associate agreement. I'm so glad that, and first of all, thank you for a great presentation.
You're welcome.
Very informative as always. I was very glad that you and Dwayne both mentioned the business associate agreement. We do receive a good amount of calls about business associate agreements, practices. Absolutely need one. I'm glad you both talked about it. I just wanted to comment about the importance of practices using a business associate agreement. And as Dwayne mentioned, using your own business associate agreement, and you showed it as well, Sharon, because outside organizations, they may ask you to sign their business associate agreement, and that's covering them.
Yep.
And you will still be held liable if you don't have them sign your business associate agreement, which is covering your practice. So that's a really important point. And we do get questions about that as well. For anyone who may have access to your PHI or may, as you mentioned, both of you inadvertently see or have become accessible to PHI. So very important. And Sharon, I just wanted to ask, mine's twofold. Sorry, I wanted to ask for we have a lot of small physician practices with limited resources. So what's the one single most impactful step they can take right now to strengthen their cybersecurity and reduce that risk?
It's twofold. One, check your routers to make sure that they're secure. And two, train your employees. You can go online, Google search it, TikTok, whatever. There's videos out there that you can use at little to no cost, except maybe hauling them in to the meeting room and buy some pizzas or whatever. That's what I would do.
Great. Thank you so much.
Thank you so much for the great presentation. I just want to mention for those that are on today that the Medical Society of Delaware does have a YouTube channel. If you're not familiar and not subscribed, please subscribe. We do post educational videos on that platform, as well as our social media pages, Instagram and Facebook, where we share different events and things like that. So please, if you're not following us, join us. We will be sharing this session on our YouTube channel. And if you do have any questions that may come up after today's presentation and you want to email me, feel free to send me an email and I'll be happy to get you connected to Dwayne or Sharon. I want to thank the two of you again for a great presentation.
Thank you.
Absolutely.
Have a good day, everybody.
Have a great day.